using Hibiclens as a surgical skin preparation.
Getting ready for your surgical skin prep requires that you have all of your supplies ready ahead of time. As you can see, we have our surgical prep kit. And in this instance, this particular kit, we're going to go ahead and we're going to not use this solution, and we're going to replace that with certainly the Hibiclens solution. We have 4x4s, we also have sponges, and we have our umbilical sticks as well. So most facilities will have several different varieties of a skin prep kit. You may elect to use a sponge, you may elect to use a 4x4 gauze. Either will be just fine using your Hibiclens solution. To maintain the sterility of your gloves and of the surgical field and your prepping area, we're going to go ahead and ask somebody else who could be in the room with you to go ahead and pour your Hibiclens solution. Thank you. We're now ready to begin our surgical skin prep. One thing to note, Hibiclens does not need to be diluted. It's ready to go as soon as you pour it from the bottle. We also have made sure that our patient has the appropriate towels in place to avoid any pooling of the product during the procedure itself. Using ARN recommended practices, you're going to start at the incision site using concentric circles and working your way outwards. First off, we're going to start with the umbilicus. I'm going to put a little bit of Hibiclens right on the tip of that Q-tip and just go around the umbilicus, concentric circles, and then discard that Q-tip. And we're going to do that times 2. Once again, we're going to go around the umbilicus and then discard. Next, we're going to use just a couple of sterile 4x4s. Get that saturated with your Hibiclens. And beginning at the incision site, you're going to use concentric circles, working your way outwards in this type of a motion. And you're going to give that area a good scrub for about 2 minutes. We're going to use one more. And once again, we're going to start at that site, work our way out. Nice concentric circles there. Then you will take your sterile towel and you will just pat the area dry. Remembering to move the towel from the far side of the patient towards you. Repeat the procedure with Hibiclens, getting that sterile 4x4 saturated, beginning at the incision site once again, using concentric circles, working your way out, scrubbing for an additional 2 minutes, and then patting dry.